Hi, everybody, and welcome to this week's What's Up Wednesday interview series. If you're new here, we just meet with guests of our network and share out resources to the industry. I hope everybody had a great long Memorial Day weekend. Today, we are joined by Brandon, who is the president of Optima Benefits and Payroll. He's going to be going over all things docs by phone on our resource platform. So, hey, Brandon, welcome and thanks for being with us today.
Why, thank you. Great to be here.
Of course. So, to kick us off, just briefly explain your role and how long you've been with Optima Benefits.
Well, so Optima is a business that my father started around 2003. I was a financial advisor in Manhattan from that period until 2008 when I decided to come home and work with my father. So been about 13 years now that I've been within Optima and running it probably now for the last 5 years. My brother's also in the business. He actually runs the payroll department. I run the benefits side. And so we're a nice family-owned, operated business in Rochester, New York. And I've been working with CCA Global now roughly 13 years, which is how we ended up getting tied in with you folks. And
the connection, right?
Opened up a lot of doors, a lot of opportunities, and helping a lot of people, which has been nice.
Yeah, that's great. Kind of good overview, but explains that connection too. That's awesome. So for those who are unaware, may not know it exists at all, explain what that docs by phone service is on that.
So this has been a really popular benefit within the child care centers, mostly because of the effect that it does allow and have for workers in the child care center. And of course the price, it's an extremely affordable benefit. And so that's really where between the value that it provides, the cost, it really is, it hits a lot of sweet spots with the childcare world. So we've been offering this plan for roughly 5 years. We actually can go to our website and get information, and I'm happy to, if you send out my information, I can talk to people one-on-one and provide additional information. But our website is cca-benefits.com, so CCA Global. So cca-benefits.com is the website. So you'll see on there we have our docs by phone, but we also provide other benefits like dental and vision insurance that would be available to your members. And these are all plans that have been negotiated already on your behalf based off of the size and scope of the membership that we already work with and offer these to.
Oh, right on.
So okay. They are open pretty much year round. There's no waiting periods for any of this stuff. So really nice little pieces that most childcare centers are trying to figure out the benefit piece right now and sure. Offering and trying to entice and bring in employees and provide that little extra something to attract and retain employees. And so these packages, in my opinion, are extremely affordable, extremely effective, and are something that you guys can all plug and play tomorrow and basically start saying we have available. And of course, they can be voluntary too. So they don't have to be employer paid in any way, shape, or form. You can just simply offer them to the employees as benefits that are available to them through your company, your organization. And it's up to them to decide to purchase or not. If they decide they want it, you can payroll deduct, whether it's dental, vision, or the docs by phone, payroll deduct their portion, and off you go. So kind of just adds a nice little way for you guys to just really put together a benefit package pretty quick.
So the charge just depends kind of on what they're interested in, and that varies, I guess, based on location. Probably.
Correct. Yeah. So the docs by phone right now is at $8 for groups. So if you're a group and you have one employee or 100 employees, whatever the case may be, the cost is $8 per employee a month, and that $8 will cover not only the employee, but everybody in their family. And so with that, the docs by phone provides them complete access to a physician 24/7. And that call to the physician will actually cost them nothing. It'll be a free call to speak to them about things like strep throat, bronchitis, sinus infection, pink eye, UTI, poison ivy, you name it, anything that you can almost self-diagnose for yourself. They're able to make that call to the physician, tell them their symptoms,
clarify that,
kind of go with it. If they determine that a prescription is necessary, they will then call that into the pharmacy of the employee's choice. That'll then be there for them to pick up. Within the docs by phone, there's also a prescription discount card. So they can pretty much go use the discount card, pick up their prescription right at their pharmacy, all without leaving their house other than go to the pharmacy. So,
Sure.
what we're seeing with the childcare centers is, a lot of these are hourly workers. So, for them to take off time from work, that costs them money. Not only that, but I know childcare centers, there's certain rules and regs around you guys having a number of teachers in a
Present
room
there,
at a certain time, depending on the amount of children. And so it allows you to kind of, curb some of the absenteeism with employees not having to take off for something pretty mundane that they can almost just take care of with a simple phone call.
Sure.
So just has a lot of merits that I think could help the staff as well as the employers when it comes to the Docs by Phone program in and of itself.
So that's available to, you said, staff and the provider, any family members of the staff, or just?
Yeah, so the way the enrollment works, it's a very simple enrollment. It's actually, you can do it online through our website, or I can send you an Excel spreadsheet.
Okay.
And it really just asks for the employee name, their email, and their mailing address. So there's no socials. I think it does ask for the date of birth, but there's no social security numbers necessary. And what will happen once it gets set up, they'll actually get an email, a welcome email saying, hey, you're ready to go. That's when they can register. And that's when they can also add their family members to the plan if they decide to, or if they have them to be added. They will then also get a packet in the mail with a card, an ID card, the prescription discount card. So all that stuff will be mailed to them as well directly. So they'll get an email first to register their account. They can also call a phone number to register. That's all within that welcome email. So it's a pretty quick, easy process.
Yeah, that's pretty well-rounded. And you covered kind of symptoms people may be calling for. So doctors that are available, just really depends on what they're needing, right?
Exactly. Yeah, it's very much I've used it for poison ivy. I'm out traveling. That's another great benefit.
Yeah.
If you're ever traveling, I was out of state, and it's like I don't have a doctor. So what was my option? I was gonna have to go to an urgent care center. That was gonna cost me $120 just to walk
right
in the door.
Sure.
Or go to an emergency room. That's $1,000. So it just has a lot of helpful little pieces to it that outside of just your day-to-day stuff at home.
Okay, perfect. So what is that time frame? Kind of how often can they utilize it? Do they have to renew at any point in time?
It'll just continue to renew. There is no limit. So it is that $8 is an unlimited access, for them and their family. So there is no cost outside of the monthly premium, which is a huge benefit. So you'll go to places like Aflac. I don't even think they're doing it anymore, but they would charge maybe $49.99 a month or a per call type of situation. A lot of people just didn't use it because they're not going to spend $50 on a phone call. But if they're paying $8 a month, it's a very small number to know that you have that access behind the scenes to kind of help you in the event you need it.
Right. So everything you're saying is great, obviously. So I guess just what are the overall benefits or the importance of the childcare industry using that service? Clearly that it's
well, I kind of touched on it a little bit, just the fact that workers taking off time, they don't have to do that, which is, they, of course, if they're sick, they don't need to come into work. But if it's something that's, not, a serious type
mundane,
of situation, instead of having to, take the time to go to see the doctor, pay the cost for the doctor, you just make this simple phone call and it's, you're seen, you get your need met, and you didn't have to take off all that time and effort to get handling something that's pretty simple.
Perfect. Okay, yeah, that's great. So what other states are involved with this program? You talked about the funding that we're going to be kind of talking about.
Yeah, so we've obviously, with all the funding that's been going on, some states are looking at this as a way to offer a true benefit to all employees of the states, and so it's just such a solid value. I guess the value is just so immense that you're giving people that may not have a healthcare plan or may not have easy access to a doctor, or maybe have a high deductible plan, or all these different factors. This just checks a lot of boxes for, the amount of care that they can receive, as well as the low cost associated with it. It just brings a lot of value. Another thing that it's not on our website, but it is also becoming, it is available, is a mental health component. And so that's becoming another very popular item on the state level, in that I know that as part of the funding, one of the benefits is to promote mental health and awareness for those things. And so, within our platform, we do have have access to add mental health therapy within the Doctors by Phone platform.
Okay.
Obviously, there's an additional cost for adding that component.
Sure.
I want to say it's another $6, so maybe $14 all in.
Still though, that's great.
Yeah, and you would have no cost therapy sessions, basically.
Wow.
Unlimited therapy sessions. So I know therapy sessions can be extremely, extremely expensive. And so I want to let you be aware, though. So there's a difference between counseling and psychology, and then there's psychiatrists that are actually able to prescribe medicine. And so psychiatrists, there is a fee to actually see a psychiatrist to then be able to be prescribed medicine, and that's a $240 copay for a psychiatrist visit. So that is expensive, but all the other counseling or that type of stuff that's not through a psychiatrist would be completely free
under that original
for those sessions.
Perfect. Okay. I will be including a link. The resource platform account is free for everybody in Colorado. I think I've mentioned that on several What's Up Wednesdays before through the Daniels Fund. And I'll include the link that he had said if you have any more questions for that. But is there anybody that you contact specifically, or can they just go to that site for any questions or to learn more?
The site, and they should be able to get to me that way. I can certainly, I'm more than happy to provide my information. So my email, I'll give you the easier one, is info@Optima, OPTIMA, Benefits Group.com. If you have any questions or you want to, schedule a time to chat further, be happy to do that. And just kind of walk you through if you have interest.
Sure. Great. That's awesome. We appreciate your time. If there's anything else you want to share, just kind of advice or suggestions wise to the industry on the topic. Otherwise, we'll let you have your day back.
Okay. I don't think so. I think you covered most of it. I think if there's interest, I'm happy to help, and I look forward to it.
Okay. Awesome. Thanks, everybody. Thanks, Brandon. Have a good one.
Thank you. All right. Take care. Bye-bye.